suicide prevention has become a pretty big thing in Brevard Public Schools. It's an initiative that was undertaken in the past year. I know it was a budget priority. Tina, explain that.
Preparing to run for this office and then getting elected in November, I had many things on my plate that I wanted to accomplish, and many priorities, and suicide prevention was not one of them. Mental health was not on my radar whatsoever. I didn't even think about it as being part of this job. Within a few days of being sworn in, getting my laptop, and getting the updates of what's going on in our district, I was shocked, to say the least. The numbers coming in daily and weekly of children that are Baker acted, sent to circles of care because they've been found a threat to themselves, the number of students suffering from severe anxiety, severe depression that we actually put through our system of identifying as a potential suicide risk. They're called suicide risk inquiries. Those numbers, I was astonished. And within a couple weeks of being elected, I was notified of the first student since I was elected to have taken his own life. Since then, we've had 9 students take their own life. So very quickly, my priorities as a board member started moving down a bit, and suicide prevention, mental health awareness, depression, anxiety help took the forefront. And so I brought that forward when we sat down on our budget priorities list as something I felt like we needed to do. I proposed a small amount, relative to our budget, $16,000, to put in at least an assembly in each school to help communicate directly with students. And immediately the board was like, yes, absolutely. We were able to rank our priorities and what we wanted to accomplish, and that rose to number 1 for everyone. So I'm grateful for that. We have a lot of work yet to do. Not to say we're not doing some amazing things already. The north end of the county has a program in place that the district has written a grant for to try to get spread into all of our schools. So that's a good thing. We have also in our budget priorities, we hired many social workers now to put within our schools to help connect families and parents that are struggling with the right places in the community to get the help and support that they need. Our job is to educate students, and I've heard the arguments for that we shouldn't be doing anything else, but it's certainly hard for a child to learn if they are suffering from depression and if they have anxiety. And our numbers this year since I've been elected in the past year, are 3 times higher than they've ever been in our history of recording these things. The trends in our county and in our state and nationally are all growing. It's getting to epidemic proportions, and so it's something that we have to address and face.